On January 30th, the Biden administration announced that the COVID public health emergency would be declared over on May 11th, 2023. That COVID public health emergency had just been renewed, effective January 11th for an additional 90 days. That renewal was by the U.S. Department of Health and Human Services Secretary Becerra, and it actually was the 12th time the COVID public health emergency was renewed since it was first instituted back in early 2020. Now, right now, that COVID public health emergency is set to expire on April 11th. We have an additional COVID emergency in effect as well, the COVID National Emergency, which is set to expire March 1st of 2023. What the Office of Management and Budget in the Biden administration has done is give us instructions of what steps are coming for these two emergencies. First, they say both will be renewed on their current expiration date. So that COVID National Emergency will be renewed on March 1st, and the COVID Public Health Emergency will be renewed on April 11th. Both will be renewed to an eventual end date of May 11th, 2023, at which point both emergencies will expire. Now, the Office on Management and Budget is giving this announcement now. They said because they want to stick to the commitment of the federal government to give at least 60 days notice before there is a change in the designation of the emergency. And by giving the notice now, they've actually given over 100 days notice. So states, hospitals, and patients have a chance to plan. We also suspect they're responding to some recently introduced legislation, both a House bill and a joint resolution that sought an earlier end date to the emergencies. The Office of Management and Budget said an abrupt end to the emergencies would cause chaos and confusion for states, for hospitals and doctors' offices, and most importantly, for the tens of millions of Americans. They wanted a bigger transition time so people had time to plan. Now, one other thing to remember, the expiration of the public health emergency does not change the current planning for the end of continuous eligibility and Medicaid. Congress, in their Consolidated Appropriations Act, also called the Omnibus Spending Package, set an end date to continuous Medicaid eligibility as April 1st, giving states 12 months to initiate unwinding of continuous Medicaid eligibility. That still stands as the plan. Now we also know when the COVID public health emergency will end, and that is, again, May 11th, 2023. You can read more from the Office of Management and Budget. We link to their statement in the description below.